Ectopic beats are one of the most common reasons people notice their heartbeat. They can feel like a skip beat, a flutter, a thump in the chest, or as though your heart suddenly pauses and then beats more forcefully. In most people, occasional ectopic beats are harmless. They happen when an extra heartbeat occurs slightly earlier than expected. This can come from the upper chambers of the heart, called atrial ectopics, or from the lower chambers, called ventricular ectopics. And almost everyone will have ectopic beats at some point, even completely healthy people. They can become more noticeable with stress, lack of sleep, caffeine, alcohol, dehydration, or during periods of illness. Some people particularly notice them when they are lying quietly in bed at night, simply because there are fewer distractions and they become more aware of their heartbeat. So when should you see your doctor? If your ectopic beats are new, becoming much more frequent, or happening repeatedly throughout the day, it's sensible to get them checked. You should also speak to your doctor if they are associated with other symptoms such as dizziness, breathlessness, chest pain, or feeling as though you might faint. Another reason to get assessed is if you already have a heart condition, for example, previous heart attack, heart failure, cardiomyopathy, or significant valve disease. And if you have a family history of cardiomyopathy or sudden cardiac death at a young age, recurrent palpitation should also be discussed with your doctor. Your doctor will usually start with an ECG, but the ectopic beats may not happen during those few seconds. So if they are occurring intermittently, you might need a longer heart monitor for 24 hours, several days, or sometimes longer. This allows us to work out exactly what type of extra beats you are having and how frequently they occur. Blood tests may also be useful to look for things that can trigger palpitations, such as anemia, thyroid problems, or abnormalities in your electrolytes. In some people, particularly if the ectopic beats are very frequent, an echocardiogram may be arranged to check the structure and pumping function of the heart. The important thing to remember is that feeling ectopic beats does not automatically mean there is something wrong with your heart. For most people, once we establish that the heart is structurally normal and the ectopic beats are benign, reassurance is often the most important treatment. But if they're new, frequent, worsening, or associated with other symptoms, that's when it's worth getting them checked.